Cholera. What is it? It is a bacterial infection caused by Vibrio cholerae. This pathogen is a gram-negative bacillus that is highly motile. It has a single polar flagellum and survives best in basic conditions. This bacteria itself is not the problem. Instead, it is the toxin that it secretes. Vibrio cholerae experiences lysogenic conversion via infection of the filamentous CTX bacteriophage, which contains a single-stranded DNA. This phage is indirectly the cause for the excessive watery diarrhea associated with the disease, but we're getting ahead of ourselves. For optimum virulence, the toxin secreted by the cholerae bacteria includes the cholera toxin, CT, coded by the genes provided from the CTX phage and the toxin co-regulated pili, TCP. However, different strains of cholera have different levels of the proteins to make the toxin secreted unique and the symptoms of each cholera outbreak different. Thus, the response to antibiotics varies depending on the outbreak. How does one become infected with this pathogen? This bacteria is often spread through drinking contaminated water or eating raw shellfish or undercooked meats. Many people who have become infected do not realize that they are infected. However, they can contaminate others via shedding bacteria in stool samples and contaminating other waterways. Over 1 million bacteria are required to cause an active cholera infection. Luckily, this amount easily corresponds to drinking 1 glass of contaminated water. People who have the greatest risk of contracting cholera live in an area where poverty, war, or natural disaster have caused overcrowding and unsanitary conditions. So moral of the story is, drink filtered, clean water. Otherwise, you could potentially end up with cholera.
How does a cholera infection actually develop? The pathogen enters the body when the host consumes contaminated water through the mouth. However, the bacteria is tricky as it avoids the acidic conditions of the stomach. Because the stomach acid would kill the pathogen, Vibrio cholerae attaches to its host's small intestinal walls. It binds using a type 4 pilus attachment, which is a secure attachment to avoid being removed by the host's bodily washing systems. Once bound, it releases the CTX toxin, which begins to cause problems in the function of the intestine. The toxin is taken up by the enterocytes via endocytosis and interacts in a biochemical pathway cascade that ultimately results in disrupting the flow of sodium, chloride, and potassium ions. This ion flow disruption results in rapid loss of water, which leads to severe dehydration. The pathogen then exits by being sloughed off in stool excretions from the infected host. How does one know if they have cholera? The infected host will develop symptoms within a few hours to a few days of consuming the infected water. One of the telltale signs of a cholera infection is the rice water diarrhea that is light in color and high in water content. Excessive diarrhea can lead to dehydration as the body is excreting large amounts of water. Once the host has lost over 10% of their total body weight, severe dehydration has occurred, leading to an imbalance in the electrolytes. Dehydration and low electrolyte levels are characterized by muscle cramps due to rapid ion loss or shock, which results from low blood volume and low amounts of oxygen circulating through the organs. Other possible symptoms experienced include nausea, vomiting, irritability, lethargy, sunken eyes, dry mouth, extreme thirst, dry or shriveled skin, little to no urine output, low blood pressure, and an irregular heartbeat. If a patient suffering from cholera is left unattended, the disease could result in death from dehydration, hypoglycemia, hypokalemia, kidney failure, or shock. If you've been to an area likely contaminated with cholera, drank unfiltered water, and are starting to experience any of these symptoms, see your doctor right away.
How is the cholera infection confirmed? In order to diagnose a patient with cholera, the physician must assess the symptoms while taking samples of stool from the patient. The samples are then plated on a selective media containing thiosulfate citrate bile salts. Another diagnosis method used is known as rapid immunochromatographic dipstick testing, which analyzes stool samples. The patient will also have blood drawn to test for antibodies present, as this could indicate an infection. How is cholera treated? Treatment begins with rehydration therapy in order to increase the fluid levels in the body. The possible methods of rehydration therapy include oral rehydration salts and IV fluids and electrolytes. It is important to start rehydration therapy quickly, as dehydration can occur within the first few hours of symptoms. The patient then receives antibiotics to fight the bacterial infection in the lower intestine. If the patient is an adult, they will be given doxycycline or tetracycline, while an adolescent or pregnant patient will receive azithromycin. While taking the antibiotics, the patient must continue to consume large amounts of liquid to remain hydrated. A child may be given zinc supplements to decrease and shorten the duration of diarrhea. As long as the infected host receives treatment, the risk of fatality is decreased to under 1%. Thus, it is important to seek medical advice if you suspect a cholera infection.
Are there ways to prevent the infection? With modern amenities and the increase in water and sewage treatment, the risk of being infected with cholera has drastically decreased. The Advisory Committee on Immunization Practices is in the process of approving vaccines for travelers entering cholera-infected locations. These vaccines include Vaxchora, which is a live oral vaccine taken in a single dose, and Dukoral and Shankol, which are non-live oral vaccines. If approved, these vaccines will be effective for 3 to 6 months and are only recommended for travelers likely to come in contact with the pathogen. Cholera is a dangerous bacterial infection that results from infection of Vibrio cholerae. If you suspect infection, seek treatment right away to avoid the deathly consequences that may result.